Hi, my name is Ana Mora Camacho. I will be showing a quick review of Lab 1 models. So first we're going to start off with the male rectum. Here we could see the rectum cavity of the male in the blue right here. This is where it emphasizes more. The male reproductive system contains the testes and the prostate gland. Now the female rectum is in this area. It looks a bit smaller, but the female cavity, the female reproductive system does contain the ovaries and the uterus. That's the difference. But here it's showing the rectum. Now right here we could see a slide of the spinal cord and the brain. Awesome. The temporal lobe, frontal lobe. All right, and then here's the heart. Oh, okay. Here, this blue looking tube is the inferior vena cava. This red one is the descending aorta. I'm gonna remember them by the blue and the red and their positions. Here is the larynx or larynx. I'm still working on how to pronounce that. That's kind of positioned in our throat, I would assume. And then here we could see a clear demonstration of the esophagus, the stomach that lies under the liver. The large intestine is like the big worm that is wrapped around the small intestine. Here's the same one, but it demonstrates the salivary glands. Right here's the esophagus, the liver, the gallbladder right under here. This is the stomach, large intestine, small intestine. Here's a more up-close view of the esophagus. Here behind the stomach lies the pancreas and the spleen, the large intestine, and then above the small intestine. Here in this image we could see, okay, I'm going to try to pronounce this. It's the duodenum. I'm going to look that up because I feel unsure. But here in the small intestine is located the jejunum. And in this little area is the ileocoel junction, ileocoel valve. And here the ileum, located right here, almost going towards down the pelvic area. This is the transverse colon. This little white line is the ascending colon, and here on this side is the descending colon. Here we can see a view of the gallbladder, the adrenal gland, the kidney right under it. Here's the pancreas. Normally the stomach will be like right here in this area with the large intestine and everything. Here's the spleen, the kidney, yes, the duodenum, which is this tube-like structure. Alright, here is the heart, the bronchiole. This is once again the abdominal aorta. Here we can see the right upper quadrant, which is located right here. It's always going to be on the right of the patient, not on your right, but their right. Here will be the left upper right quadrant. This one will be the lower right quadrant, left lower right quadrant. Now here more in depth is the diaphragm, the little kidneys, one here, one here. Here's the ureter. Oh, here's the large intestine, the bladder, and here's the spleen. Once again, the adrenal gland. Here we could see the lungs. Once again, the diaphragm right under the lung cavity area. Here, the trachea, almost close to the esophagus. The bronchus, which would be these tube-like structures. The esophagus, down here. Here we see a closer view of the esophageal hiatus, right here, connected. And here we have this is going to be the right lobe of the liver, right because of the right of the patient. This is going to be the left lobe of the liver, left of the patient. Right here is the transverse mesocolon. This is the large intestine. Here it is. Right in this cavity area, this is the central tendon of the diaphragm. Here's the lungs, the heart, the liver, the stomach right under the liver, the large intestine, which is wrapped around on top of the small intestine. Here is, right above it, would be the greater omentium. Right here is the left upper quadrant, left lower quadrant, right upper quadrant, right lower quadrant. The right upper quadrant right here, right next to the liver. Left upper quadrant, right in the stomach. Continue. So the front of the person will be the anterior, and behind will be the posterior. This is the head, the neck, the thoracic region. This is the abdominal pelvic region. This will be the upper limb and the lower limb. Now right here we're more in depth with right of the patient will be the right hypochondriatic region, and right here will be the epigastric region. Right here, very close to the belly button, will be the umbilical region. Just think of when a baby is born, they need to cut the umbilical cord, which is in this region of the belly button, and the left hypochondriac region in this area. Now right here is, so this location will be the right lumbar flank. Right here, going towards the V-line, would be the right inequal iliac region. Going more towards this area would be the hypogastric pubic region. Now on this side will be the left lumbar flank region, left inequal iliac region. Now here we're able to identify the major regions of the head. Here is the parental, the temporal lobe, the occipital, and the frontal lobe. Here's the facial region with the upper teeth, lower teeth, right with the orbital, all there. And here are some directional terms. We could call it the medial. Medial is kind of where it's meeting towards the middle of the body. Now inferior is it going down towards the body. Lateral is going away from the body. Not to the center, but away. Kind of like the opposite of medial. Lateral would be definitely the opposites. And superior going up. Just think of people that think they're superior to others. They think they're higher above. Just going up. Proximal is going towards, like almost going towards the brain. And then distal will be going down, like distance. The distance, more distance down. And then here I have more notes. I kind of drew some images that have been helping me along the way. These are smaller images up here to help remind me of the different directions that this can have. And I'm currently still working on Lab 1, remembering these terms and making sure to pronounce them right. Thank you so much for watching.